Hello.
Naveen, long time.
Yeah, I'm fine. It's such a long time.
Dr. Abhijit.
Hello.
Also,
Hi, I'm Shobana.
Hi, Shobana. Nice to meet you.
Same here. Sojan, hello.
Yes, ma'am. Good morning. Dr. Pradima Murthy will join in a minute. She's just got the link and she's joining. Hi to everybody. Dr. Abhijit, Dr.
Hello, hi.
And congratulations.
Thank you.
Ma'am, can't hear you.
Hear me? Can you hear me now?
Ma'am, your voice is very low.
Very faint. Hardly can hear you.
Can remedy that. Is this better? Yeah, it's okay now.
A little more if you can increase, ma'am, that would be better.
Your voice is booming. Get somebody to do this for me. Just give me a second. Audio is better, but this is
Good morning. I hope I'm audible.
Yes, ma'am.
Yes.
Yeah, good morning. A very good morning to all of you.
Morning.
Yeah. Every year on the 26th, International Day Against Drug Abuse and Illicit Trafficking is observed worldwide to strengthen action and cooperation in achieving the goal of a sustainable world free of substance abuse. Whether it is individuals, organizations, communities, or countries, all should join together to create an acute awareness about substance abuse and promote a stigma and discrimination free society strengthened by outcome based interventions. Current theme of Share Facts on Drugs and Save Lives would enable discussion to promote the importance to combat misinformation by sharing the real facts and risks, research findings, evidence based data, life saving facts and solutions in order to continue tapping into a shared spirit of solidarity. On this note, I warmly welcome our eminent panelists, Dr. Pratima Murthy, Director, National Institute of Mental Health and Neurosciences, NIMHANS, Bengaluru. Dr. Shobana H., Associate Professor, Lokopriya Gopinath Bordoloi Regional Institute of Mental Health, Assam. Dr. Naveen Grover, Associate Professor, Institute of Human Behavior and Allied Sciences, Delhi. Dr. Abhijit Nadkarni, Associate Professor, Center for Global Mental Health, London, and also the co-director of Sangat, and Dr. Sojan Anthony, Associate Professor NIMHANS, who would moderate this panel discussion. A very warm welcome to all of you.
thank you.
COVID-19 has brought unprecedented public awareness on health, protective measures for staying healthy, and most importantly, on protecting each other. The global health crisis has further demonstrated the need for these collaborative approaches in achieving a vision for health for all, to bridge the gap in access and in knowledge and resources that vulnerable populations far too often encounter. A growing sense of this global community and solidarity continues to emerge, as does the need to ensure healthcare for all. Acknowledging the importance of this integrated approach, Nasha Mukt Bharat Abhiyan, a drug free India campaign has been flagged off in 272 districts of our country, which were found to be most vulnerable based on the data available from the survey conducted by the ministry and other sources. Important stakeholders like young adults, youth, women, children, educational institutions, and civil society, who may be directly or indirectly affected by substance use, have been given the responsible opportunity to drive this campaign on various levels, right from the grassroots, and bringing in community involvement and ownership. In the past year, I'm very proud to say that more than 80 lakh people have been reached through a host of activities and interventions, and have seen a vibrant participation of 35 plus lakh youth and 28 plus lakh women so far. Similarly, 13 plus lakh students have been reached through events and competitions organized in 6,000 plus schools. So this has led to a positive momentum of the issue of substance abuse being addressed and reducing the stigma around it. Social media is also being extensively used by the ministry through Facebook, Twitter, and Instagram posts to maintain the measures and efforts made for the drug demand reduction in the country. We also have students working as interns for us to reach out to people across the country through their social media posts. So I'm sure this panel discussion will provide the listeners insights and knowledge on the current Indian and global scenario on substance use, the neurobiological, socio-cultural factors that lead to substance use, evidence-based treatment and interventions, and the role played by other therapeutic community interventions, which are largely effectively directed towards the achievement of interlinked and interconnected sustainable development goals. I thank you all very much for your participation and support for the cause of Nasha Mukt Bharat Abhiyan, and would now request Dr. Sojan Anthony to take forward this panel. Thank you so much.
So thank you, ma'am, for that brief introduction and giving us a summary of initiatives by Ministry of Social Justice and Empowerment. So we are also seeing a lot of public involvement in campaign, especially among youth. And I used to tell as a joke, the color of NIST has become yellow to green with the Nasha Mukt Bharat Abhiyan. So we see a lot of green growth. So we all appreciate that initiatives. Briefly, let me introduce the our eminent panelist. As ma'am already mentioned, Dr. Pradima Murthy. Ma'am is a professor of psychiatry, and currently ma'am has become the director of NIMHANS. So we all are proud that the all addiction researchers are proud that one of the leading institute in India in the health sector is directed by a addiction researcher, come a mentor for many of us. And Madam is also a part of Center for Addiction Medicine for 3 decades. Her research and consultation and training services have been used by World Health Organization, UNODC, ILO, and many such initiatives. For your knowledge, I think you all know that very recently World Health Organization recognized both India as well as Madam for her consistent contribution in the field of tobacco control and allied activities. There are a lot of initiatives have been taken place in NIMHANS under her able leadership for both prevention and capacity building and in the field of treatment. So let me also introduce our welcome to this panel discussion, ma'am. Let me also briefly introduce all our other eminent panelists. So we have Dr. Abhijit Nadkarni. He is an associate professor at Center for Global Mental Health. He at the London School of Hygiene and Tropical Medicine, UK. So Dr. Abhijit is connected both with the UK and India, at the same time, and he's a well-known researcher in the field of addiction. And he also offers the consultation services to various other countries like Egypt, Nepal, Pacific Islands countries and Kenya. So we have a right talent, both, and he knows about Indian scenario because he's a co-director of Sangat, and he has initiated addiction research wing in that, and he leads, and also he actively involved in the capacity building, both in research as well as the various innovations in the field of addiction. We have Dr. Shobana H. We will all call our mentor's mentor because she has been here with NIMHANS for many years, and later she moved to the various other institutes, both in India as well as abroad. She was part of the Asmara Ertia University in Northeast Africa, and also Madam has a rich insight in the family dynamics. So she will be in a position to help us to understand the various social dynamics which may cause us both risk factors and barriers in seeking help, and she also can help us to understand the how can we have a lot of community based intervention to prevent substance use disorders. And currently she is also the president of Association for Psychiatric Social Workers in India. With Dr. Naveen Grover, a very friend of all of us. So Dr. Naveen Grover, he also has been a part of various institutes, which includes NIMHANS as a faculty member, Kasturba Medical College, KMC Manipal, one of the prestigious medical institute in India, serve as a clinical psychologist as well as a faculty there. Currently, Saris is associated with the BAS as a faculty member of the clinical psychology. He has been part of both training as well as he's also his research areas basically in the field of application of psychotherapy and nurturing psychotherapeutic techniques among various clinical psychology professionals. And he is also can help us to understand how we can apply CBT, cognitive behavioral therapeutic approaches in this field. And he is also in various capacities. He is associated with NIMHANS, AIMS, PGI, and other leading institutes in India. With this brief introduction about our panelists, let's go to the theme. Once again, I wish to remind you all the theme is share facts on drugs and then save lives. So we can have 3 rounds of discussions, and each round each panelist can take all of you can take 4 to 5 minutes first as a response to the question. The first question, I think we can start. Who is at risk? That's the question. We know it's a struggle. Being away from drugs is a struggle, and then those who are from the who is more vulnerable, or who are the whom we need to give more attention. So let me start with Professor Pratima Murthy as a mentor of all of us. I think Madam can initiate the panel discussion.
Thank you, Sujan. I think the most important thing is really to realize that all of us that are at risk at different parts of development. I think, for example, unborn children are at risk if pregnant mothers happen to use substances of any kind. Again, children are at great risk because even though the initiation may not be in early childhood, it's a very vulnerable part when their brain is growing. So any kind of drug use among young children can be very detrimental because it can affect their brain development. We know adolescence is a time of great risk, and we know that a lot of substance use as well as mental health problems begin in adolescence. So in terms of a focus on prevention, adolescence becomes very important. But right now, we also know it's a problem of young and middle-aged adults who have a lot of consequences in terms of physical, mental, social, occupational consequences. So that's another important thing. And now we're recognizing that among the elderly, and Abhi and I have actually done some reviews on this, that among the elderly also, there is a growing problem of substance use. It is also across gender. What we thought was a male limited problem, we now know is across gender. So I can see that a whole host of people along the developmental continuum are at risk to substance use. But we do recognize that adolescence is the time when it actually begins. And therefore, it's in the preventive aspects of it. While all these consumers are important, adolescence is possibly an important area to pitch in.
Thank you, ma'am. I think I'll let me go to the next panelist, Dr. Shobana H. Ma'am, I just wanted to know you will be able to speak at regional risk factors as well as the socio-cultural risk factors involved in, in both developing the and the using the drugs. Over to Shobana, ma'am.
Thank you, Dr. Sojan. Now, when we look at risk factors, I think Dr. Pratima had covered most of the issues related to the age factors, gender, etc. As far as the socio-economic factors are concerned, addiction has been strongly associated with unemployment, poor socioeconomic conditions, then not congenial or adverse family conditions, conflict areas, etc. Coming specifically to the regional aspects of this, I mean, since I represent the Northeast region, you can see that recent studies do talk about um, the most percentage of use of these narcotics, I mean, the drug use is in the northeastern region in comparison to other parts of the country. Probably the reasons being like, as I said, there are a lot of structural and developmental reasons, issues that needs to be taken into consideration to understand the risk factors. And the main thing also being some of the states in this region share the international border where there is a lot of illicit trafficking going on. That makes the youth there more vulnerable to use of these substances. So that is one aspect of it. So availability and access to drugs is also another risk factor that is a major risk factor that we see in these a few of these states in the northeastern region. Thank you.
I think all the panelists are keeping their remarks in very brief. Thank you. I think we are on time. Let me move to the Naveen Grover. And Dr. Naveen Grover, you have insight both about developmental aspects, cognitive aspects, and the intra-psychic dynamics of individuals who are tempted to use the substances and things like that. So I wish to listen from you, sir, about the risk factors from psychology point of view.
Thank you, Susan. And uh, I wish to kind of like pay my regards also to Dr. Pratima, was our teacher when I was at NIMANS. Although I did not work with her in her unit or directly with her, but kind of like, so congratulations to her also. And to my co-panelists and the joint secretary for making us part of this panel. Yes, you're right. I mean, that's what when I was going through some of the literature when this invitation came up. So I was also went to the ministry's website and I saw that about the day. So I also came to know about that. Yes, they say that why do we celebrate international days? So that was insightful for me. And then I realized that yes, I mean, we make fun of it that Father's Day, Mother's Day, and these kind of days. There are so many days which has come up. So what impact? But then I felt that yes, it does have an impact. For example, I'm wearing this pink shirt. I mean, it was a deliberate choice, and of late it has become a deliberate choice. Looking at the gender, they say that it goes only with the one particular. I mean, the woman gender, it goes more. So I said that no. I mean, it has to be the gender perspective has to be put in place. So that's where, in psychology terms, if you see, we say that developmental stage is the one which is extremely crucial in terms of their cognitive capacities also. Yes, because they have lesser ability, they have lesser control over their environment. So that's where they become more susceptible for. So if you add along with their cognitive abilities, if you add their what we call it, poverty and lack of love, lack of appreciation, and all those things, if we, because what we say is that every human requires love, care, appreciation, and all those kind of things. So once there is a deficit of that, one, there is a deficit of that. Two, there are things which are opposite to that. For example, it's not that there is a lack of love, it's that there is physical abuse, there is sexual abuse. So when those kind of things also happen in the developmental stages, that makes them more vulnerable for using the substance, and they become more vulnerable to continue with their substance abuse. And they say that initially, that's what I was reading, like work from the researchers in India. It was a summary of those works. So because I am mostly a more clinician, lesser of a researcher, so I work more and spend less time on the research. So when I was reading that material, and then I saw that they say that, yes, I mean, that's true also, that people first enter into, say, alcohol beverages and those kind of things. And usually in the pre-puberty area, they are actually only labeled with a single substance abuse or diagnosis or dependence. But as they move forward, it starts becoming polysubstance. So they start getting introduced to the more sub. So that also brings us to the peer pressure, because lack of the poverty and all the other circumstances, vulnerable, for example, lack of housing, especially if you see in the metro cities, this problem is very rampant. If you just walk across the roads of the, I'm sure, Bengaluru or Chennai or Delhi or any kind of, like, you will find under the bridges, there will be so many youngsters, I mean, so many children, not even youngsters, so many children which are using substance in a huddle, in a group, kind of like they are doing that. There are various things they find cheaper substances. They try to find as cheap as possible. They try to find it from the gutter or from. So all these things are, yes, vulnerable. The peer group, when they tell them exciting stories about that, what happens once you take the substance, it does not make you feel hungry. It takes your pain away and you are in a different world. So when those kind of exciting stories are told by the peer to these members, these children, so slowly and slowly they graduate to the multiple substance abuse and like that. So for me, if you ask me, I would say that the poverty, the age of, I mean, that when they're young, their cognitive abilities are poor, they are not in control. The hopelessness and the helplessness, something which we see only in the, say, psychiatric disorders like depression, like that and all, but it has a significant role to play, because they are very hopeless and very helpless, which leads to the poor self-efficacy, which is again is a very poor self-efficacy and self-regulation, which is again is something which is required to stay away from these drugs. So I would say that these are the factors which actually connect with each other and then create vulnerabilities for the people.
Thank you, Naveen, Dr. Naveen. So while you were sharing these facts, I was also just thinking in Bangalore urban, the crowded areas where the youth may not have space in their own house to have get-togethers. They just move little away from their housing area and then celebrate the get-togethers. It may be a vacant land or a cricket stadium, and where they are under less social control and parental supervision. So
On the railway tracks,
yeah. So it naturally increases this all the psychological factors which you shared becomes factors which may influence the substance use among the youth. Now I wish to go to Dr. Abhijit. I think I kept both doctors from medical field at the end, so they can also balance it. Dr. Abhijit, I am sure that you have both global experiences as well as Indian experience, and you also might have mapped a lot of high risk behaviors in population while you are doing addiction research. Over to you, sir. You are not audible, sir. I think you need to unmute your mic.
Yeah. Sorry. So I think from what all of the other panelists have said, it's quite clear that there are various ways in which we can actually organize these risk factors in our head and how we work with them. So, for example, how Pratima organized these risk factors on a life course perspective. I mean, what are the risks at different timelines in your life? which is important. I prefer to organize in my head, at least, the risk factors in terms of what is called as an ecological perspective, which is if you look at life or individuals kind of living within concentric circles, at the center is the individual, around them are their closest communities, which is families. And then you kind of broaden the ripple effect of that, and then look at the schools and the neighborhoods that they live in and the larger society that they live in. And there are risk factors within or vulnerabilities within each one of those. So, for example, if you look at an individual, what are the vulnerabilities within an individual which put them at risk of developing substance use disorders? So, for example, and these will then change across the life course perspective. The risks for a young person is not the same as an adult, and which is not the same as for older adults. So, for example, what are the vulnerabilities that reside within an individual when someone is young? So, an example would be attention deficit. If you look at a slightly older young person, then we are looking at impulsivity. Young people are geared or hardwired to take risks and be impulsive. And one way of being impulsive is to take substances that put themselves at risk. Or they are at greater risk or more vulnerable to be influenced by other people around them, which are their peers. And so the peer pressure kind of starts coming in. So you are now looking at the next circle. If you're looking at the family-based risks, you're looking at poor attachment, disrupted families, abuse happening within families. That's the next level around the young person. And then the third, larger societal risk factors, which were alluded to by Shobana, which are around availability. If there is increased availability of a substance within your larger environment, you are more likely to use it as compared to people who live in environments where there is not enough availability. So we're looking at risk factors or vulnerabilities happening at different levels. And this we can then map onto different age groups, because these are going to vary based on the age group. And before I finish, I just wanted to, I don't know, Sujan, if you're going to cover this, but I just wanted to kind of say that a lot of our discussions and a lot of the narratives around substance use are built around risk factors or vulnerabilities, which means that we don't pay much, which means we don't pay much attention to resilience factors, you know, because at the end of the day, if X number of people are using drugs or the substances, we have to realize that a larger chunk of people are not using those. So what is it? What are the strengths? What is the resilience? What are the protective factors in these people which prevent them from using substances? And we need to be focusing on those resilience factors as well, and not always looking only at the vulnerabilities and risk factors.
I completely agree with Dr. Abhijit Nadkarni. Having such a huge number of young population in our country, still we are able to manage the numbers, and that shows, the inherited our value system and social norms help us to have better control over these issues. We'll come back to the third round about looking how to nurture all these protective factors, strength factors to create an effective preventive strategy. Now, I think briefly we go to the next round where we can discuss about how can we help people who are struggling with the drug abuse. Here, I also want you to address various myths and misconceptions, stereotypes about the users and treatment facilities. There's a lot of pessimistic attitude towards the both treatment process as well as rehabilitation strategies. And you also can share about the good aspects of treatment, our success stories, and out to Dr. Pradima Mutimam for sharing her initial thoughts.
Okay, so just to tie up whatever we've been discussing so far and then trying to connect it with interventions for people, I think one must never forget that all drugs of abuse, whether it's alcohol, tobacco, any other drugs, are psychoactive substances. And they obviously have effect on the brain. And we know that, for example, that addiction runs in families. We know that it's a interaction between biology and the environment. So whatever it is that sets it off, and perhaps sets it off earlier for people who are at risk. The biological aspects of addiction in terms of higher loading in families at risk, families who are also at risk because of the various kinds of deprivation are important things, because that's the soil in which the problem appears and then translates into an addiction. So one of the key messages is obviously, I love the message of the ILO traffic light model, which is really to keep the greens green. And in some ways that ties in with what Abhijit was saying about looking at resilience, about looking at what were the positive expectancies from substances, something that Shobana alluded to. And then looking to see how these expectancies can be provided by other factors. Perhaps we'll be discussing that a little bit later in the third part of the discussion, but that's very important because we would like people not to initiate substance use, and or at least delay it, till their vulnerabilities and their brain development, etc., has actually taken place, and they're in a better stage to be able to negotiate the use or non-use of substances. So that's very important. The second thing is about early intervention. Now, somehow, many of the substances, but we make this distinction between legal and illegal substances, and somehow the use of these substances like alcohol has become normalized in communities. So one of my students actually carried out a study, and various people have carried out studies and found that there's almost a 10 to 12 year delay from actually having the first problem associated, let's say, with alcohol and actual treatment seeking. We know from the National Mental Health Survey that the treatment gap is upwards of 80 to 85%, which means out of every 100 people, only about 10 or 15 individuals are seeking treatment. What has happened is, I think what we have done is what is called the pyramidal approach to substance use, which is really only focusing on people who are very severely addicted, trying to help them, meeting with a lot of resistance because drug addiction is a chronic relapsing condition. And then there is a lot of therapeutic nihilism or a feeling that you cannot help people with addiction. So somewhere along the line, I think it's important to reverse the pyramid and to try and help people not just graduating to substance use, but preventing it from going into a more severe problem, which is about early intervention and engagement of young people so that their progression does not occur. And those things have to be done by a large number of healthcare professionals in the community. In fact, the most important thing perhaps is really, I won't go into the community intervention, but at least at the clinical level, for every healthcare provider to be asking about substance use in anybody who presents to healthcare, providing early interventions, brief interventions for substances, recognizing when people need more intensive intervention, and then referring them to more specialized services. I think that's very, very important to understand. The second myth, I think, is that addiction is not treatable. And I think that's something that we need to change in the community. People need to understand that, of course, addiction, like any other disorder, if it is, well addressed, if it is treated with empathy, with respect for the individual, and separating the individual from the addiction. A lot of healthcare professionals tend to view not the substances as a problem, but the individual as a problem. So somewhere along the line, separating the individual and the drugs and taking the individual on your side is a very important part of the therapeutic aspect of addiction. The third thing is that there is a lot of support that is required for people, and any treatment service should not just look only at pharmacotherapy or only at individual counseling, but really try and get as much support as possible. And the fourth thing is, given the chronic relapsing nature of substances, it's not enough to it's not like treating the flu, where you just give one evaluation and one set of treatments and things are over. You need to keep handhold people with addiction for a longer time till they really learn how to manage this. I'm going to stop here. I'm sure somebody else will address the myths associated with the substances.
Thank you, ma'am. I think that I think it gives a clear direction and vision about the treatment. I think out to Dr. Shobana. See, I have seen that many families struggle to seek treatment. They don't know what to do, and the person is not willing. A lot of abuse and domestic violence happens in the family. So it's a big struggle for families also, those who are facing this challenge. I wish to hear from you about what to do in that scenario now.
Thank you, Sojan. Half of my thoughts have been put forward by Dr. Pratima when she spoke about, the support system. That is very, very important. And if you look at it, family, even especially in India, they are the unpaid, unrecognized frontline workers, the caregivers. We don't recognize them, and they are the ones who take the brunt of everything. So when we talk about risk, the family members who are, going through this addiction process, along with their members, they're also at high risk for other mental health issues and for addictions themselves. So what I would like to tell the families is that the family's will and motivation is not actually going to ensure sobriety of the person. The individual's motivation is very important, and the family's support and helping the individual go through these process. It's a process. This recovery is a long process, and the families need to be able to go along and be able to support the person to go through these lapses and relapses. So that is one important aspect. Then the other, reaching out to the peer group becomes another, working with the peer group becomes another important area, because other than the families, it is the peer group who has the next major influence on adolescents and even the adults. So working with the peer groups and empowering them to help the persons in need is also something that we need to look at. And there are mental health professionals like the clinical psychologists, psychiatric social workers, other than the psychiatrists, of course, to whom people can reach out and discuss, and it can be through the peers and the families that can be done. Now, as far as I also feel, teachers, the educational institutions, they also play a huge role in this. Now, addiction or use of substances, it has become a lifestyle. It is, to use the term, it's very cool, and that is the way one needs to go. So, and the positive attitude towards drug use is another big hurdle that we need to, overcome, and it's a very challenging thing. The other aspect is working with the communities and when the cultural, there is a cultural sanction and acceptance in use of certain substances, that becomes a challenge. And working with community leaders and promoting lifestyles which, to the young people, which are incompatible with addiction, is one of the things that we also need to look at. Thank you.
Thank you, ma'am. I think you have covered the participation of various stakeholders in ensuring the support for the both family as well as individual. Now, the one mantra during COVID-19 we are keep hearing is stay safe, stay healthy. I think that I think it's a very good mantra for even for addiction disorders. Dr. Naveen, this is a big struggle to motivate people, right? No, and even after reaching certain levels of motivation, sustaining motivation is also a big challenge. I'm very sure that psychologists have done a lot of research in this area, how to help people to sustain their motivation, both in seeking help and then continuing their or practicing the recovery strategies which are promoted by the clinicians and other support team.
Yes, you're right. I mean, motivation is one of the core issues, or maybe the only issue which works in addiction. They say that अगर वो छोड़ना चाहते हैं तभी वो छोड़ सकते हैं, otherwise they cannot. And we have seen, for example, in North India, at least I am aware of many religious places where people have struggled for years. हम लोग उनको treat करते हैं. It's like revolving door phenomena. We'll treat them, they'll go out, they'll get relapsed, they'll come back. But they'll go to a religious place, they'll take a walk, they'll say that from tomorrow I'm not going to take it, and suddenly they are kind of like doing well for throughout their life. The follow-ups have been done like कि उसके बाद से उन लोगों ने शुरू नहीं किया है. So motivation is again is a very complex phenomena in that sense. You keep trying with the person does not get motivated. But they go to a community place, a religious place. I mean, there are different researches done to understand that. I'm sure one, I remember very old research someone did with the Professor Raghuram. They had done it in Tamil Nadu at a religious place. They had done that related to this. So those are the ones. So if you ask me personally, I feel that we have, again, it's kind of like very audacious, but we have so many, as we are saying, we're outnumbered. As far as the number of mental health professionals goes in India, we are outnumbered. So if you ask me, I would rather put in my efforts where I feel that the outcome is going to be positive. Although I won't say that I will follow that dictum in my whole of kind of like this thing, but somewhere I will feel inclined to that a person is already motivated, to whom I feel that the change can happen to him. But then at the end of the day, the research also tells us that how do you precisely say that whatever your hypothesis is, that this person can change or this person is low motivation or high motivation? How do you know that you are making a correct hypothesis? How do you make that you are making it? So if you do not get into that also, that's what the same is. Whoever reaches you, whoever comes to you, it becomes my ethical responsibility to work with that person. If the motivation is high, very good. Motivation कम है, तो मुझे उसके साथ में मेहनत करना है. लेकिन that's what we say, action and reaction are equal and opposite. अगर आप बहुत ज़्यादा push करने की कोशिश करते हैं किसी को, so then that person also can rebound back. So that's also has to be taken care of. You need to understand the different perspectives. Like sometimes we say that the using of the Premack principle. That क्योंकि चाहे वो drug abuse है, लेकिन this is bringing a lot of pleasure or maybe the negative reinforcement in that person's life. Pain से avoidance मिल रहा है उनको. There are so many other psychological, like as I said, hopelessness से उनको दूर जा रहे हैं, helplessness का feeling से वो लोग दूर जा रहे हैं. So when they are able to get away from these kind of things, so it's in a sense works for them as a reinforcement. तो आपको उनके system को समझना है. उनके system को समझने के बाद, if again you try to so motivation is, as Dr. Shobna is also saying, that the family dynamics. So you have to enter into their system and then be part of their system, take help of as many resources as possible, teachers, family members, community workers, frontline other workers, और जो NGOs, अगर आप जितने ज़्यादा लोगों को अपने साथ में जोड़ सकते हैं, मेक ए चेन फॉर दैट पर्सन. आपके क्लिनिक से लेके अगर वहाँ तक की कम्युनिटी तक की अगर आपकी चेन बनती है, तो यस, एज प्रोफेसर प्रतिमा वाज आल्सो सेइंग, कि आपको खाली, you don't have to just start it. It's not a one time. So you have to complete the whole chain. जब तक हैंड होल्ड करना है, जब तक कि वो लोग अपने उस चीज को सीख ना जाएं. Yes, there are certain myths associated with it. Like one of the most famous is the social skill deficit model, which says that ड्रग्स लेने के बाद मेरा कॉन्फिडेंस बढ़ जाता है. आई एम एबल टू स्पीक विद द पीपल काइंड ऑफ लाइक with great confidence. They also feel that it is required to mingle with people. It is required to make contacts. It is required. It helps you in your business. As we said that, okay, so if you are sitting and having drinks with somebody, so maybe you're spending 2 hours, 3 hours with that, so you actually develop those relationships. But people don't understand that the kind of cost. So we need to make them aware, as we are saying, share facts about the drugs save lives. So in the same way, if we tell them that for a shorter gain, for a small time gain, or for a, what we call it, like the long range, how consequences you are going to see, kind of like those. We also need to make them understand, as we are saying, the myths they have. They say that my uncle is drinking since 100 years. I mean, he's 100 years old and he says that he's drinking since 100 years. and is healthy. So पीने से तो कुछ नहीं होता है. So maybe they need to be educated about their kind of like biological responses. So that's where we are saying that yes, facts are necessary. They also say that it actually makes them good at sex. I mean, there are people who come and who say that they want to involve in sexual activity without the use of abuse of a substance. They are not able to engage in the sexual activity. So the people have so many range of misconceptions which they come with, and yes, they have to be dispelled. And
Yeah, I think, thank you, sir. I think there are myths, which are holding people. The people who are starting use for decreasing the social inhibition, they themselves completely withdraw from all kind of social interaction after becoming regular users or addicts. So now I wish to listen from Dr. Abhijit about the various experiments across the world, in fact, to enhancing the quality of care for people who are struggling with drug addiction, addiction disorders.
Sure. Thanks, Sujan. When I speak about models of care in other countries, you realize that there is nothing magical. There is nothing uh, kind of amazingly innovative that we can't do in India, because it's merely about being innovative within the resources that we have. And we have to understand that the West is not much different in terms of resources, right? I mean, you alluded to the fact that we don't have enough specialists to provide the kind of care that we need for the huge number of people who have these problems. And developed countries are not any different. I mean, they also struggle with resources. I think it's more about being more innovative and efficient in our use of resources. So, for example, what do I mean by that? The way we have structured our services in India is to put the onus of providing care for people with substance use disorders on tertiary and secondary care institutions, which are manned by specialist health workers. That, I mean, that would be an ideal setting if we had enough number of those tertiary or secondary care settings with specialists manning those. Unfortunately, we don't. I mean, we know that we have tried to do that. We have put in a lot of money and resources. The government has been doing it for years and will continue to do that to see if we can build up those resources. But I mean, history tells us that we have not been successful in doing it. So, what is the one thing that we could learn from what's been done in de-addiction services in the West, which is basically to ensure that you filter down some of these uh, things that need to be done to help people with substance use problems. So you don't need a person with substance use disorders to be going to a tertiary care institution or a de-addiction center to get the services. A lot of these things can be done in primary care. So, for example, simple things like what Pratima said right at the outset is asking people whether they use substances. I mean, that's where it starts, right? Unless you ask, you don't know, and if you don't know, then you can't provide the services. So, training our primary healthcare providers to ask these questions at every clinical encounter. I mean, do you use alcohol? Do you use tobacco? Do you use any other substances? Once you know, then you can put systems in place to provide care for that. Then there is a huge evidence base on frontline, very basic, brief interventions that can be implemented at primary care levels, for which you don't need specialists. This is something that can be put in place. You don't need specialist health workers. You don't even need healthcare workers to provide some of the interventions that can be delivered. I mean, in the West and in the systems that I worked in the UK, we had drug workers who were people who were lay people who were trained to provide frontline care for people with drug problems. Sometimes these drug workers were people who were themselves drug users who had now recovered. Now, this might be something slightly radical for the Indian setting, but that's I'm just giving you an example of what can be done using lay health workers or lay professionals who can provide frontline healthcare. And I think the other thing that we probably need to do is kind of shift a certain way of thinking around recovery. Our way of thinking around recovery is that it's very black and white. Either you recover or you don't recover. Either you stop your substance use or you don't stop your substance use. We need to use a non-communicable diseases paradigm for substance use disorders as well. What do we do with diabetes? When someone with diabetes comes to us, we don't say that once we control your diabetes, that's for life. And we don't blame a person if their blood sugars start going up when they are on treatment, right? We understand and we accept that there's going to be a fluctuating course. There's going to be times when your blood sugars are to be well controlled. There are going to be times when they're not going to be controlled. And they're not controlled well, we kind of relook at your diet, we look at the medications, tweak the medication. And hence, we also need to look at recovery in the same way. It's going to be a fluctuating cost. You're going to have people with substance use disorders who will reduce their substance use or stop their substance use, and then something happens in their life. They might go back to substance use again. You need to start working with them again. And I think this perception about recovery as something that's black and white needs to change, and we need to kind of understand that this is more like a lot of other non-communicable diseases, and there are going to be good phases and not so good phases, and it's our job to help the person to go from that not so good phases back to the good phases. There are several other things I would like to talk about, such as prevention strategies, etc., but I guess I don't want to hog the time, and I'll just kind of stop there.
Thank you, Dr. Abhijit. I think that's the another myth is complete abstinence versus the harm reduction, various other approaches. You're also throwing light into the different approaches in recovery. Madam, I think finally we are the last round. We want to listen from you the vision statement for the country. How can we strengthen the preventive strategies? They're already doing good job, as Madam in the beginning told, having a brigade of youth, like having 1,800 interns are spending their brain for preventing substance use across different pockets of India. Ma'am, being a National Institute director, we want to listen from your vision statement for strengthening the prevention strategies. Ma'am, unmute, yeah.
So one of the things that has happened on a positive note is that I think we understand that we should not be working in silos. And I think at least in the last 20 years, that was what was happening. We were looking at kind of defining roles, who has to focus on treatment, who has to focus on rehabilitation, who has to focus on prevention. And you realize that unless there is working across sectors, drug abuse is a very, very complex problem. And there are no simple, one fit, size response that is going to answer going to be a response to this complex problem. So I think one of the things that we know are the accessibility to substances. So right from accessibility to treatment, I think we need to have responses, a coherent set of responses across the board. So for example, young people in a neighborhood, if they have very easy access to substances, of course they're going to use it. What are you going to do about that? We already discussed in this seminar that there are some people who are more vulnerable than others. It might be children of parents who use substances, children in impoverished backgrounds, young people who are highly stressed, young people who are very impulsive and lack attention. What are the protective things that we can do for these children, and who is responsible for that? We talked about, this normalization of drug use in the community. How do you denormalize it through appropriate messaging for people? Who does that? We talked about the huge treatment gap and the need to make sure that the health systems, the community health, when I say health systems, it does not necessarily mean only institutional health systems, but also community healthcare and welfare systems. How do they respond in terms of encouraging early intervention and self-help, for example? Because we know that the earlier you control your substance, the better it is. And then, of course, in treatment, and let me tell you, in spite of several decades of intervention, there is still a huge treatment gap, which also means that we do not have enough facilities to provide this whether it's brief intervention, whether it's more intensive intervention. We need an array of services in the community, and we certainly have systems in place, whether it is through the primary healthcare models, whether it's through the health and wellness clinics. I think we need to use a lot of these resources in addition to having community-based resources to help us to address the immediate effect. And remember, these are the people who are also going to be helpful in the follow-up of people who seek specialized care. And of course, once you give specialized care, it's not just enough to do that. You have to have a follow-up. And we've actually demonstrated that generally in substance use, particularly people who develop addiction, the retention in treatment is very low, the outcomes are very low. But if you have somebody who is kind of supporting the individual in follow-up, you actually find that a lot more people retain in follow-up, and they do that. We also have learned to use digital approaches now to counsel people. We have quick lines, we have M cessation programs, but these need to talk to each other. So I think at the end of the day, it's not just enough to develop interventions, but the fact that these interventions need to talk to each other. So I would like to see, programs for pregnant women as part of antenatal care to tell women, the risks of using substances like tobacco, alcohol, other drugs. What are the dangers? Interventions for pregnant women who might be using drugs. 2, people who are elderly, who are alone, who are lonely, who might have comorbid depression. So that brings you to the other fact of people who have comorbid physical illnesses and mental illnesses. And we know that all substances are associated with it. So I'd like to see a multi-morbidity integrated model which looks at all this. And of course, I love the ecological model too. So a developmental and an ecological perspective to make sure that different stakeholders all come together to work. There are some lessons from tobacco control, which has actually shown a decline in the use of tobacco, and that has required complete multi-sectoral participation. So I think we have to really gear up and do that rather than work in silos. And I could see that as a way forward. And I think it's very, very important that we do that. We look at prevention and we look at intervention. But most importantly, I think for people to understand that they can be healthy without the use of substances, they can have better ways of dealing with their anxiety, having a good time, and indeed with problems like attention deficit or impulsivity. Those I would see as important interventions to prevent substance use.
Thank you so much, ma'am. I think the other panelists will spend one minute quickly. I may not come in between so we can save time. Dr. Shobana.
Yes, I agree with Dr. Pratima about multi-sectorial work, which is, one hand does not know what the other is doing. That is the scenario that we see these days. So we need to have, I would say, school-based programs, have normative education on drug use and problems related to drugs, bring them into the curriculum, have better alternate recreational engagements for youth. That also is something that we need to think of. And then I would also like to see more of prevention focusing on women. What we see is, though the prevalence rate among women is low, but the impact of addiction or the impact of drugs on their lives is much more, where they are involved in sex work, there is unwanted pregnancies, there are so many health related issues, also violence against women. So get them also into the fold and have programs which addresses their issues. And then family oriented programs where family well-being is fostered. Thank you.
Thank you, Dr. Naveen. Sir, unmute and speak, sir. Yes.
Yeah, so to me, it seems that the gender has to be made a focus. The woman needs to get more focus for the intervention. So that's something. And I also feel that the people they want to get help. They are ready to get help, but the skill we have to inculcate in our task force. I mean, the people who are working, as we are saying. So to me, it seems that there are two principles to be followed, something which we are actually losing, dharma and karma. So you do your service as your duty and with selflessness. So if that's something which we need to teach our task force at every level, I'm not talking about only the professional, I'm talking about the front line to the whole chain. So I think if that's something which we can inculcate in them, so that's also is very important that we teach them, because slowly and slowly they don't see it as their duty, they don't see it as selfless, they want something in return. Returns are not very high, so they get discouraged. This task force gets discouraged. And also, I would like to say finally that it's the developmental stage where more energy has to be put in, more funding has to be put in as a preventive aspects, their self-efficacy, their self-regulation, and giving them more protection from abuse and other things. If we are able to do that, this is one of the core reasons, which actually leads to the further when we have to deal with them in their adolescent and in their adulthood. So I think these are the three core areas which I also see.
Thank you, Dr. Naveen. Over to Dr. Abhijit.
I know we have run out of time. Do I have a minute?
Yes, sir. Yes.
Okay, thank you. So in the interest of time, I'll just focus on one point. I guess unlike Pratima in her role and Ms. Chakravarti as the Joint Secretary, I don't have the luxury of having a vision. I'll probably talk about my dream for this field in the country. I think, and I'll just focus on one, which is prevention. I guess one of the historically what as a country we are focused on within the prevention space for substance use disorders is building awareness. It's important, but what we have seen from a lot of research evidence across the country, across the world, is that building awareness can just change our knowledge about substances. Sometimes it might change our attitudes towards substances, but does not necessarily change behaviors. And at the end of the day, what are we targeting? We are targeting behaviors. We want people to stop or not start using substances or stop using substances. And that's a behavior. And so if we want to get people to change behaviors in our prevention strategies, we need to move beyond building awareness. We need to be targeting people's ecosystems. We need to be working with families. We need to be working with schools to have interventions which build resilience, reduce risk factors, and stop people from initiating substance use or break that cycle at very early stages when people have just started using substances before they turn into substance use disorders.
I think. Thank you so much. We had a very fruitful discussion last 1 hour. We have discussed from birth to death. All of us are at risk, and also we have.
Dr.
Yes,
Sojan, if I can
yes.
have just 1 minute.
Please, ma'am.
Yeah, I mean, this is a very, my mind has gone into a whirlpool with a panel discussion and hoping that, we'll come out of, excellent implementation strategies and ideas, which we can do with the, for eradicating the substance use. But 2-3 points which really struck me is that the resilience factors or the protective factors that needs to be integrated into the strategy. So far I agree that we have been only trying to prevent. We have assumed a situation which is backed by our statistics, and then we were going with that, how to do, what to do. And also, but this point that resilience factors and the protective factors also should be strengthened, that's a very good takeaway from this discussion. And a research probably on the between the link between the ecological factors and the substance use. Why a particular child, if we have 2 children, why is one more prone to substance use and addiction, and why not the other, given the circumstances being the same? That's probably one thought I got. Maybe we should have sponsor a research on that. And the third thing is how to sustain motivation. What is there today may not be there tomorrow. And as we said, there's no black and white. As Dr. Abhijit has pointed out, there's no black and white about the things. So how to sustain this motivation to be substance free? That is, I think, one component. It's a very good takeaway from us. But as far as the ministry's interventions are concerned, I just would like to inform the panel, this very eminent panel, is that all the strategies so far devised and are in the process of implementation. We are focusing on the youth, the women, sex workers, the transgender persons, and involving all educational institutions, families and caregivers, teachers, and also some kind of interventions where involving the peers within the school settings, and largely what should be the community involvement in all this, how to sustain this entire effort if the community does not come up and feel their responsibility. So basically our strategies, we have centered around all these components. This is what I wanted to inform the panel, and I thank you really all very much for your inputs. And now over to Dr. Sojan.
Yeah, let me repeat the statement again. From birth to death, we have seen the vulnerability factors. We also have seen the role of mind to society in treatment. Definitely, there is a involvement is required. And also, what is the most interesting psychotherapeutic quote in Indian land, which I heard, is what Pratima Madam yesterday also repeated, like what Sri Krishna told. All of us have to do our duty without waiting results. The results will emerge. Naturally, results will emerge. So with these words, let me conclude from my end. I thank all the panelists, Professor Pratima Murthy having a so busy schedule. Madam spent time with us. Dr. Abhijit Natkarni, Dr. Shobana, Dr. Naveen. Above all, Ms. Radhika Chakravarti have being a joint secretary of the unit, spent the entire 1 hour with us and listened, and she summarized also. And also, I also thank my friend Dr. Sijo, national coordinator, for helping to organize this panel discussion. I thank all Nasha Mukt Bharat Abhiyan team, who are not tirelessly working for the success of this campaign or this mission in our country. Thank you so much.